Okay, I've gathered my supplies and I'm going to go into the patient's room to perform a head-to-toe assessment. Knock, knock.
Hello?
Hi, my name is Heather. I'm going to be your student nurse today. Is it okay if I set my belongings on your side table?
Yep.
Okay, thank you. Hand hygiene. I'm going to provide privacy. I'm going to make sure that that is locked. Could you please confirm your name and date of birth for me?
It's Brandy Giovanni, and it's 12/30/1990.
Okay, thank you, Brandy. And then do you have any allergies that I need to be aware of?
Nope.
No? Okay. What about the common allergies? Any allergies to latex, adhesives, betadine, iodine?
Nope.
Okay, any food, medications, environmental factors?
Nope.
Okay. So
So
since you're here today, we want to perform a head-to-toe assessment. I'm going to ask you just a few simple questions, and then I'm going to go into your vitals, and then just kind of going through working from your head to your toes. And then at the end, I'll ask you some subjective questions to get some additional information. Do you have any questions before we begin?
No.
Okay. Before we do your head to toe, is there anything specifically you'd like to address or talk about during today's visit?
No. I
Okay.
don't think so.
And you did confirm your name. Can you tell me where you are?
Casper College,
Okay. What month is it?
November.
Okay. And then who is the president?
Trump.
Okay. So you are alert and oriented to 4. Let's see. Do you have any spiritual or cultural considerations I need to be aware of?
No.
Okay. Looking at her posture, she is relaxed. She is not in distress. She is not tripoding. Looking at her grooming, she has great hygiene. I do not smell any foul odors coming from her mouth or her body. Her tone of voice is calming and appropriate. She's able to listen and follow commands and respond accordingly. The clothing is appropriately fitted. There is no ill-fitted clothing or anything that's torn and dirty. Let's see. Okay, so then I'm just going to start with some vital signs.
Okay.
If I can have you sit on the edge of the bed and dangle your feet off. Okay, perfect. Do you have any pain at the moment?
No.
Okay. On a scale of 0 to 10, 10 being the worst pain, 0 being no pain, how would you rate your pain?
0.
0, okay. I'm gonna grab your temperature. Okay, go ahead and look this on your tongue. Perfect. Okay, great. So that's gonna be a 98.3. And then I'm just gonna have you put this on your index finger. That one?
Yep,
Okay, go ahead and relax. And I'm going to grab some blood pressures and roll up your sleeve.
Perfect. So your pulse was 72. And
All right, you can go ahead and relax your
I'm
arm.
going to take your blood pressure to any medical devices.
No.
Do you have a removal? No. Do you have implants of birth control? Okay, and do you mind if I use this arm? No.
Maybe I can get it a little bit this way. Okay, perfect. And then I'm just gonna feel for your brachial. Okay, great.
And I did clean this up still before I came in here. Except that one's. Oh, wonderful. Okay.
I got 116/60. Are you taking any blood pressure medications? Okay. And then with the pulse ox, you are at 96, and that's going to be on room air. Okay, I'm just going to count your respirations.
High blood pressure? I haven't. Low blood pressure? No. Do you take blood pressure medication? I do. Okay. And for me, are you in any pain at all? No. Anywhere throughout your body? No. Wonderful. Okay, so can you tell me your name? My name is Brittany. Do you know the date? It is the 24th. Okay. Wonderful. And do you know where we're at? Do you know what we're doing? Okay. So my arm is awake. She is alert 1 times 4. When looking at her overall appearance, she seems to be in a good mood. She is willing to cooperate. I am not noticing any difficulties with her speech or ability.
Okay, so for your radial pulse, I got 60, and then for your respirations, I got 14. Okay, so then I'm just going to continue with my assessment. So I'm going to just lightly palpate your head. Do you feel any pain or discomfort or tenderness?
Nope.
Okay. Looking at your hair, it is evenly distributed. I don't see any lumps, bumps. I don't see any bruising. No signs of infestations. I'm going to palpate your maxillary and frontal sinuses. Any pain or discomfort?
Nope.
Okay, go ahead and raise your eyebrows for me. Okay, squint your eyes. Perfect. Smile for me. Can you frown? Puff out your cheeks. Okay, you have good facial cranial nerves. So then I'm just going to assess your eyes. Go ahead and close your eyes for me. Looking at your eyelids, there is no redness, no swelling. You have evenly distributed eyelashes. Looking at your sclera, it is white. Your conjunctiva, it is pink and clear and moist. And then I'm just going to assess your pupils. So go ahead and just stare straight.
Overall appearance, the hair distribution.
Okay. And then go ahead and stare at my pen, and then stare at the wall behind me, and then back to my pen. Perfect. And then I'm just going to have you follow my pen.
Just gonna check. Wonderful. Right, sit up.
And we're going to go in, and then back out. Perfect. Your pupils are equal, round, reactive to light and accommodating. There is no signs of strabismus, nystagmus. I don't see any discharge, swelling, redness. So then I'm just going to move to your nose. Your nose is midline with your face. It is appropriate for your facial size and shape. I don't see any bumps and skin breakdown on your nose. I'm just going to take a peek on your inside. Okay, both mirrors are pink and moist. I don't see any deviated septums. I don't see any discharge. Can you plug one nose, breathe in and out? And then the other side. Okay, both mirrors are patent. And see, no deviated septum. Everything looks good. No flooding nose, no blockage. We're going to go to your mouth. Looking at your lips, they are pink and moist. There's no dryness, cracking, no lumps, bumps, any bruising. Go ahead and open up and go. Perfect. Your uvula is midline. Your mucosa membranes and your gums are pink and moist. With your teeth, I don't see any dental breakage, any cavities. There's no dentures. There's no signs of infection, inflammation, redness, swelling. I don't see any thrush on the tongue. It is pink and moist. I'm going to go ahead and look at your ears. Looking at the skin, I don't see any redness, swelling, skin breakdown. I'm lightly palpating. Do you feel any pain or discomfort?
Nope.
Okay. Just going to look inside. Okay, there is no discharge. Go ahead and close your eyes. Let me know which side you hear a sound.
Right. Left.
Both. Okay, perfect. Go ahead and open. And then I'm gonna go to your neck. So with your face and neck, your skin is cool, dry and warm. There are some spots that are cooler. There is even distribution. It is appropriate for her ethnicity. I'm going to go ahead and palpate for any tenderness, swollen lymph nodes, any goiters or masses. Can you swallow for me? Okay, her trachea is midline. Any pain or discomfort swallowing? Nope. Okay. I'm going to feel the carotid arteries one side at a time to not block. Okay, perfect. Go ahead and raise your shoulders and shrug. Okay, can you turn your head side to side, up and down? Any pain or discomfort? No. Okay, great range of motion. I'm just going to roll up your sleeves. Okay, so then I'm just going to assess the skin on your upper and lower extremities. I'm going to take your socks off if that's okay too. Okay. Looking at her skin on the upper and lower extremities, I don't see any redness, lesions, skin breakdown, lumps, bumps. She does have some tattoos, but the tattoos are appropriate. There is no discoloration, signs of infection, signs of peeling, rashes, lesions, scarring. The temperature of the skin is going to be dry and warm, even distribution appropriate for your ethnicity. I'm just going to lightly palpate your muscles. Any pain or discomfort? No. Okay, and then I'm just going to palpate down here. Any pain or discomfort? Nope. Okay, so then I'm just going to look at your hands. Assessing the hands, I'm looking for any inflammation or deformities of the joints. I do not see any. The nails are appropriate. They're neatly groomed. I don't see any clubbing. Checking for cap refills. It is within 3 seconds. So I'm just going to move down to your feet. I'm looking at her feet. Her toenails are appropriately groomed. I don't see any swelling or deformity of the joints of her toes or ankles. I'm going to check her cap refills. They're within 3 seconds as well. Perfect. And then for your hands, can you touch your tips? Okay, perfect. And then go ahead and press your hands out. Press up against mine. Okay, flip your hands around. Press down. Okay, and then can you have them in front of you? Press against me. Okay, turn them around. Press against you. Any pain or discomfort? Nope, numbness, tingling. With your feet, go ahead and press down on my feet. Okay, go ahead and pull them up towards you. Go ahead and roll your joints for your feet. Perfect. Wiggle your toes. Okay. Any pain or discomfort? No. Okay. For your hands, can you stretch your hands up? Okay, to the side. You can relax. Any pain or discomfort? Nope. Okay. For one leg, can you stick it straight out? Okay. The other one, can you lift up with your knee? Okay. Great range of motion, both upper and lower. Any pain, discomfort? No. Okay. So then I'm just going to check your pulses. Okay, so both pulses for the radial is strong and equal bilaterally. I'm just going to check your dorsal pedal pulses. Okay, both pulses are strong and equal bilaterally. And then I'm going to check your posterior. Okay, both pulses are strong and equal bilaterally. Perfect. So then I'm going to do sensation. So then I'm just going to have you close your eyes and then tell me if you feel something sharp or dull. Touch you. Dull.
Lovely. Now I'm just going to check your cap refill.
Sharp. Sharp.
Perfect. Less than 3 seconds on each
Sharp.
side. Now I'm going to check your radial pulses
Sharp.
bilaterally. We just want to make sure same
Dull.
on both sides,
Dull.
which they are. Perfect. Okay.
Sure.
So can you grip my fingers?
Okay, sure.
Can you pull, or can you grip only for
Dull.
push against? Can you stick your arms out?
Dull.
Perfect. Go ahead and open up.
And down. Can you roll your
Okay.
wrists?
You did great.
Can you touch each
And
finger
then
to
you
your
said
thumb?
that you do not have any numbness or tingling with your upper or lower extremities. Correct. Okay. So we did fine motor skills, we did range of motion, we did pulses, we did inflammation, swelling. While I was palpating, I did not feel any edema or swelling.
Wonderful. So do you
And,
experience any
okay,
numbness or
so
tingling
then
in
I'll go
your
ahead and
hands
get
or
your
arms?
socks back on.
Okay. Do you have difficulties reaching high objects or brushing your hair? No. Have you had any? Have you broken any bones in your arms? Yes.
Just checking to see how much time is on there.
Different times though. Have you had any pain or
Okay,
difficulty
perfect.
with
So then I'm just going to move up to your chest and lung sounds. When I was assessing your vital signs, I noted that your chest, you are not in any pain or discomfort. Your chest has equal rise and fall. You are not using any accessory muscles. You are not barrel chested. So that I'm going to listen to your heart sounds. And then are you on any heart medications?
No.
Any ports or pacemakers? Nope. Okay.
When looking at her respiratory effort,
So then I'm going to start at your second intercostal and listen to your aortic. And go over to your pulmonic. Okay, going down to your third. The third intercostal space is your Erb's point. Okay, going down to your fifth, it's going to be your tricuspid. And then going over to your mitral.
So we're going to start with your aortic.
Okay, great. You have great heart sounds. I hear a good lub dub for each heart point. So then I'm going to listen to your apical pulse for 60 seconds.
And then would you mind just displacing your breast tissue?
No, with your head.
Tricuspid. And mitral. Sorry.
Here's the bra, so it's going to be under here. There. Okay. Am I? Okay. Come over here. So.
So S1 and S2 were present in all 5 locations, which was wonderful, and then that's
Okay, so for your apical pulse, I did get 16.
I'm going to listen to
And since you're not taking any medications like digoxin, that's not something that we will need to address with you. So then I'm going to listen to your lung sounds. Are you experiencing any cough, shortness of breath, any phlegm, any nasal discharge? Okay. And then you go ahead and just breathe normally, and then I'll just follow along.
Okay.
Okay, wonderful. And those were even bilaterally, so now I'm just going to flip around and I'll listen to the lung sounds there. Make sure you can still see everything.
Okay. And then I'm just going to listen to your lungs on your back. So I'll have you turn. Perfect. And then I would assess your skin and just like the front with the skin on your back. There is no lesions, bumps, scars, any rashes, skin breakdown. There are some freckles. I do not see any tattoos on the back. Okay, then I'm just going to listen to your lung sounds in the back.
Okay. So have you been experiencing any chest pain or difficulties with breathing? No. Okay, wonderful. Have you been do you have any condition with the heart? No. Have you ever been diagnosed with any lung condition like asthma, COPD? No. Have you had pneumonia or tuberculosis? No. Wonderful. Do you find it difficult to breathe sitting up, laying down? Do you notice a change in the breathing when you change position? No. Wonderful. Do you complete a self-breast examination? Yes. On yourself? Okay. Have you noticed any changes in your breast tissue, like dimpling, nipple drainage, lumps, tenderness?
Okay, so your lung sounds are clear bilaterally. I do not hear any crackles, any wheezing. You have equal rise and fall in your back. I'm just going to lightly palpate. Do you feel any pain or discomfort? Nope. Okay. And then assessing your spine. The curvature of your spine is appropriate. I do not see any signs of scoliosis, lordosis, kyphosis. So then you can go ahead and turn back around. And then I'm just going to have you lay down, and then I'm going to do a abdomen assessment. We'll get you a little closer. Okay, is it okay if I lift up your... Okay. So then I'm just going to look at the skin. The skin, again, is appropriate for her ethnicity, even distribution. There's minimal scarring. It looks like that might have been from a laparoscopic procedure. Did you have surgery?
Yep, I had hysterectomy.
Okay, and when was that?
A year ago.
Okay, and I don't see rashes, lesions. So then I'm just going to listen to your bowel sounds, starting in the left lower quadrant.
Okay, now I'm going to probably a little bit harder. So let me know if you experience any pain or tenderness. Anything?
Okay,
Wonderful.
there are bowel sounds in all four quadrants. They are normal active. I'm going to lightly palpate along your abdomen and bladder. Let me know if you feel any pain or discomfort. Nope. I'm just going to palpate a little bit deeper. Pain or discomfort? Nope. Okay. All right, you can go ahead and put your shirt back down. And then I'm just going to jump over to my mannequin for my GU. Okay, so the bed would be raised. I'm going to go ahead and lift up your gown to expose you. Looking at the skin, I don't see any lesions, redness, discharge, tissue breakdown, any sores, any foul odors, any infestations. I'm just going to go ahead and prop you on your side. Looking at your back, at the sacrum, there is no skin breakdown, any rashes. There's no discharge, there's no debris, no foul odor, no blood, no infestations back here. So I'm going to go ahead and bring you back down. We'll get you covered back up. Okay. Covered. And then we're just going to go back over to our patient. All right. And then are you okay to walk a couple of steps?
Yes.
Okay. Do you use any assistive devices?
No.
Okay. I'm just going to have you get up, walk around to the side of the bed, and then come on back. All right, and then you can have a seat. And then assessing your gait was effortless. You did not have any difficulty walking, any pain or discomfort, no assistive devices. For a few assessment questions, tell me about your current relationships.
I have a boyfriend and some kids.
Okay. Do you feel safe in those relationships?
Yes.
Okay. With your head, do you have any migraines or headaches often?
No.
Okay. With your eyes, have you noticed any visual changes?
No.
Do you wear contacts or glasses?
Contacts.
Contacts. And are you seeing your eye doctor at least once a year?
Yes.
Okay. Do you have any photosensitivities?
No.
Okay. With your nose and mouth, have you experienced any changes to smell or taste?
No.
Okay. Do you have any difficulties with stiffness, nasal discharge, breathing?
No.
Seasonal allergies?
No.
Okay. With your mouth, do you have any pain or discomfort eating or chewing?
No.
And you said no issues to taste?
No.
Okay. With your hearing, do you experience any tinnitus or ringing in the ears?
No.
Any hearing aids?
No.
Have you noticed any changes to your hearing?
No.
Okay. And then have you noticed any pain or discomfort swallowing?
No.
Okay. Any shortness of breath? Any difficulty breathing? Okay. Any signs of apnea at night when you're laying flat on your back?
No.
No? Okay. Do you use or do you do self-mammograms at home?
Yes.
Okay. Do you have any questions on any lumps or any unusual findings you've had or how to appropriately self-exam?
Nope.
Okay. For your bowel habits, are you having any difficulty urinating or having a bowel movement?
No.
Okay. Have there been any changes to how your urine or bowel movements present?
No.
Okay. No unusual smells or textures? It's not too hard, too soft?
Nope. Pretty
Okay.
normal.
And how's your diet?
It's pretty good.
Okay. Are there any improvements that you'd like to meet like a dietitian on to go over or review?
No, I don't think so.
Okay. And then your exercise, are you getting exercise?
For the most part, running everyone around.
Okay. And then are you drinking enough fluids?
I try.
Okay. I'm just going to do a quick skin turner test. Great bounce back, so you are hydrated. And then have you noticed a change to your strength or range of motion in your upper or lower extremities?
No.
You deny numbness, tingling. Okay. And then are you current and up to date with your vaccines?
Yep.
Okay.
So I'm gonna put some gloves on. Take my hand hygiene, some gloves on now.
I'm just going through my questions really quick to make sure. Any issues performing your activities of daily living?
No.
No? Okay. Are you experiencing any financial or emotional crises that you would like to speak with someone about?
No.
No? Okay.
And is there any signs of infection or anything?
Have you had any experiences with substantial weight loss or weight gain within the last couple of months?
Nothing abnormal.
Okay. Have you noticed any changes in how your heart beats during exercise or during periods of where you're just relaxing?
No.
No. Okay. No heart murmurs. Okay. Any family history?
No.
Okay. Perfect.
Pretty healthy.
All right. So I will go ahead and just have you relax. I will make sure the bed is in the low position. You have your light. I'm going to go ahead and remove privacy. I'm going to gather my belongings.
Okay.
And then I'm just going to make sure she has her bedside table back, which she does. All right, my dear. So I'm going to step out and let the doctor know that we are done. And he will come in to finish his assessment with you. But if you need anything else, just let me know, okay?
Okay.
All
Thank
right,
you.
Thank you.
Okay,